because there's an instant increase in Kapha in your body. That's why you feel sleepy. Most of the people have a lot of excessive Vata in because of excessive use of coffee, excessive use of chocolates, excessive use of certain kinds of drugs like marijuana. In fact, Ayurveda says that if you do preventive healthcare, then you will not land up in a hospital. So when the other person is shouting at you, that is a reflection of what they don't like in themselves. Love is being there no matter what.
Stale food, keeping it in the fridge and eating it, cooking for
Is
a
the
week.
worst form of diet.
Hello and welcome to another edition of the Health Tips podcast, and we are back with Siddharth Sen Gupta, there's a lot of demand for more talk on cancer and diabetes, because these are some of the things which are really affecting people right now. So we decided to go more in depth. We had done it in a previous episode, and I will link up to that right above. But let's go more in depth into cancer and diabetes, because some of it is connected at the root level of metabolism. Siddharth, welcome to the show, and let's start talking more, because we got so many questions and so much of interest about cancer and diabetes. So let's focus on that in this episode and tell people how to avoid it, how to be careful about it, and maybe how to cure it. So let's start with why do we get a disease?
I think before I get to this point, I would like to explain a very simple way to look at what disease is. If there is a leak in a boat, if you keep throwing away the water, the boat wouldn't sink, but you'll have to keep throwing away the water. But if you don't get to the root cause, which is the leak in the boat would still sink. And that's exactly what allopathy does with us. We keep taking medicines all our life, and eventually we have something else. We have another disease, to take care of. But that's not exactly how Ayurveda looks at disease. How Ayurveda looks at disease is that you need to take a check of that leak first. Where is the damn leak? So once you find out where the leak is, plug that hole. Normally, that hole in terms of human body is either with our lifestyle, with our diet, with not exercising, with addictions, with our behavior and our mindset. So all these 5 or 6 factors, or a lot of stress maybe, all these 5 or 6 factors are essentially the things that cause a leak in human body or a disease in human body, which can be taken care of. And that is exactly what epigenetics is all about. In fact, Karan, if you remember, in one of our previous podcasts, I had talked about epigenetics. I spoke about the fact that epigenetics is a small part of Ayurveda. What does epigenetics exactly say, or what does Ayurveda say in terms of Vata, Pitta and Kapha? So if you see a human body, we are made up of several organs. Now break it down into several tissues from those organs and then into cells, right? So the smallest part of humans being cells. Now, these cells are governed by what we call as DNA and RNAs, right? So DNAs and RNAs, there are 3 types of RNAs. Actually, there are 6, but we normally just see 3. Now, these 3 RNAs are mRNA, rRNA and tRNA. Now, mRNA as per Ayurveda is Vata, tRNA is Pitta and rRNA is Kapha. Now, what is mRNA? mRNA or Vata is nothing but movement in the body. When we say movement, it talks about movement of your blood, or it can be movement of your nervine system. That is, you get a burn here, immediately the nerves tell your brain that there's a burn and you have to move your hand away. So that is also Vata, any kind of movement. Your heart beating is also Vata, okay? So when you have your mRNAs sending a signal to a cell of a body, there are 200 types of cell in your body. Now, when your RNAs, like this mRNA, sends a signal to your cell and says what it's supposed to be doing or supposed to communicate or move or transfer, Now, that is the function of Vata or mRNA. Okay, I hope I'm being clear.
Yeah.
Does that make a lot of sense now? Because otherwise it becomes very difficult for normal human beings to understand the meaning of Vata.
But what I think people don't still understand is they keep evaluating themselves. My Vata is strong, or my Pitta is strong,
Right.
or my Kapha is strong.
Right.
How do you do that? How
Right.
do you understand what is prevailing in your body?
Okay. Any human being has all the three doshas at all given points in time. So mRNA, rRNA, and tRNA are always there. But each and every individual has a different prakriti. Meaning your Vat can be of a certain percentage, yeah. Your Pit can be of a certain percentage, and your Kapha can be of a certain percentage. Now that can be checked with the Nadi. Yeah, our Vaidyas are experts, they are MD in Ayurveda, and they can all check with your Nadi and tell you right away. But there is another way of doing it. In Ayurveda, it's called Ashtaveda Dashaveda Pariksha. That is, through questioning, we can also understand and derive what kind of vikrutis, or what kind of, you move from prakriti to vikruti, meaning you move from a genetic predisposition that you have to an epigenetic change in your body. Like when we are born fresh, clean, and all perfect. Now, when you move, because of the lifestyle, because of the diet you've eaten, because of the environment acting on you, all of this pushes you to a certain level of entropy, or a certain level of disease, or you can say let's say a clean pipeline that's inside you starts to get choked. Yeah. So it's because of these 5 factors which I spoke about initially. Now, having said that, these 3, that is your Vat, and I can now tell you what is Pitta. Pitta is nothing but tRNA, which is essentially the kinds of cellular digestion, or your Agni, or basically your digestion. It could be your stomach, or it could be your cellular digestion, that is from cells. The body absorbs the food that you eat, yeah, and converts that food into cells, and then and gives you energy. Now these cells then convert into something called as tissues, because a cluster of cells form a tissue. So that is called as Bhutagni, and then these cluster of tissues form what is called as an organ. Yeah, and that organ, basically this Agni, is called as Dhatav Agni. Okay, so these are the 3 Agnis, or the 3 Agnis that a human being has. Now that activity is done by Pitta. Yeah. So if your Pitta is corrupted, or if your Pitta is not good, if your Pitta is not functioning properly, what happens is the conversion of cells into tissues is not proper. So tissue formation itself is not proper. You get the point? So what happens is your organ formation is also not proper, because we know that at any given point in time, every maybe a few months or a few years, a human being becomes completely new. Exactly, a new person. So your cells keep changing, right? So the food that you eat is changing you throughout your life. And that happens because of these Agnis that you have, or the Pitta.
And how often does the human body change in your perspective? Is it like, they say 6 weeks? Is it like more than that? How?
So in various parts of the organs that you have, it varies. In your liver, it can take a certain amount of time. Your eyes could be a certain amount of time, or the cells in your eyes could be a certain amount of time. It can vary. Okay, it can vary from around 6 months to 9 months to maybe a few years sometimes. Okay, so that varies based on the organs that we have. Okay, so this is the Vata and Pitta which I spoke about. And now what is Kapha? Kapha is nothing but the formation of these organs, or the body, yeah, or the structure. Okay, so that is basically nothing but rRNA. Okay, so this completely corresponds with exactly what Ayurveda says, that Vata, Pitta, and Kapha is nothing but mRNA, tRNA, and rRNA. So Kapha is when you eat, if you don't exercise every day, you eat heavy food, what happens structurally? You'll put on a lot of weight, right? So then you put on a lot of weight, you might become sluggish. That is all Kapha. Okay, so these are the 3 RNAs which are in your body, okay, and can keep altering at any given point in time, even during the day. Okay, it's not necessary that Karan has a certain amount of Vat at around 6 o'clock in the morning, but his Vat will alter at around 2 o'clock. Like now it's 2 o'clock, so it's at 2 o'clock your Vat will probably be much lesser and your Pitta will be much higher, or it depends on, in fact from 2 to 6 it's actually Vatakal. So now actually your Vata would be much higher. This is how the Vata, Pitta and Kapha alters in human. There is a Vatakal, Pittakal and Kaphakal in the day also. And there are seasons which have Vatakal, Kaphakal and Pittakal also in seasons as well. And that's it. The entire universe runs on this same concept. Okay. So this is just to
But
explain.
can an individual, can he himself monitor this, or does he have to go to a doctor?
He can, if he, like for example, I know when my Vata is high. If we make you, in fact, many of our patients now are aware if their Vata is increasing, or if their Pitta is increasing, or if their Kapha is increasing. Okay. So when there is increase in Vata, you will normally have anxiety issues, you will have acidity problems, you will be an overthinker, yeah, you will have constipation related issues, you will have dry skin. These are some of the things, and all our patients are aware of this. Okay, we actually make them aware. We tell them that if this is happening, then you need to take a basti, and your Vata is high, obviously. Now, similarly, in case of if your Pitta is high, if your Pitta becomes high, then you will normally lose a lot of weight. You will not be able to eat spice. Okay, you will feel hungry more often. So these are ways to understand that your eyes might burn a little. Okay, so these are ways by which you understand that your Pitta is increasing. If your Kapha is increasing, you will obviously put on a lot of weight, you will be sluggish, you might be also very sleepy all the time. Especially after eating food, you notice that we feel sleepy. That's because immediately your Kapha increases. Like after you eat sweets, or you eat rice, or you eat a lot of chapatis, then you feel sleepy. And that's exactly what, because there's an instant increase in Kapha in your body, that's why you feel sleepy. So then you become aware of exactly what's happening with regards to the mRNA, rRNA and tRNA, that is Kapha and Vata, Kapha and Pitta in your body. Yeah.
But these are very generic problems. Can we get a little more specific? Because I don't think people are going to listen to this and say, oh, I'm feeling sleepy, so this must be the reason. Should they do it like that? Or how can they become better and better at truly identifying what? And is it on a scale?
It is, yes, it is on a scale. Normally, a Vaidya can understand what is the kind of scale that you are on, meaning we compare it with the Vikruti, not exactly the Prakruti, as in what you're born, the genetic predisposition. No, we normally connect it with the Vikruti that is there. Like there is a Kapha Vikruti in your body, then there will be a lot of ama or toxins in your body which are there. If there is a Pitta Vikruti in your body, it will show in your nadi itself. If there is a Vata Vikruti in your body, not only will it show in your nadi, it will also show up in terms of the movements in your body. You will start to become overactive, you will start to become more anxious, or you become an overthinker. In fact, that's exactly the problem if you see today. Most of the people have a lot of excessive Vata in their body, yeah, because of excessive use of coffee, excessive use of chocolates, excessive use of certain kinds of drugs like marijuana. So these are certainly one of the reasons why the Vata is shooting up in case of the youth today.
So in allopathic medicine, they tell you to have, say, a blood test every year.
Right.
How should a person generally do preventive health in Ayurveda?
So in Ayurveda, it epitomizes preventive health. In fact, Ayurveda says that if you do preventive healthcare, then you will not land up in a hospital. In fact, preventive healthcare has always been in Ayurveda for the last 10,000 years. Allopathy has not even got what is known as preventive. In fact, just by testing, it's not the way to actually prevent anything. You might probably understand through your blood work that you have a disease, but that doesn't mean it's prevention. What we mean by prevention is that in case your Vata, Pitta or Kapha is high, then you take certain medications, you change your lifestyle in a certain way and have a certain diet for a particular amount of time, and then you can alter it and go back to where you were 5 years ago or 10 years ago, or you can basically reverse the condition that you are in. Now, coming back to what you were asking about disease. So when we say disease, so the imbalance of these three RNAs is exactly what is disease. So going from a genetic predisposition or prakriti to a vikruti, that is it can be Vata prakop, meaning the Vata may be so high that your movement has increased in your body or reduced in your body. It can be Pitta Vikruti, it can also be Kapha Vikruti. So these are the three ways. That's exactly what is disease. And unless, like I said, Karan, that unless you know the root cause of the disease, you certainly are not able to solve or heal the disease. In fact, if you ask any oncologist for that matter, ask him why you've got this cancer. I always tell this to all our patients. Ask your oncologist.
None of them know.
No, they will always tell you.
Oh, it runs in the family, or it's
Exactly.
genetic, or it's everybody gets it these days.
Exactly. These are, people forget that these are called lifestyle diseases. So what is a lifestyle disease? It's not genetic. Yeah, it's epigenetic. And that is where the mistake they're making. They call it genetic, but it's actually epigenetics. And epigenetics says that a person can get these diseases, whether it's cancer, whether it's diabetes, whether it's blood pressure, whether it's thyroid, only because of certain food habits, certain lifestyle habits, certain exercise related issues of not exercising or over exercising, or it can be because of the environment they live in, can be a lot of stress, or can be you're in an atmosphere which has a lot of smoke in it, or it can be an atmosphere which has a lot of pollution, or actually I would say pollution is not so much of an issue because our body knows how to deal with pollution. More than that, it's the problem to do with the relationships that you're in, the amount of stress the relationships are giving you. That is the environment which actually.
Are you talking about like family and
Yes,
work relationships?
Yes, absolutely. These are the two relationships that can actually cause diseases in human beings. Yeah, more than the environment. Environment, like okay, if you're living in a place
How
where
do relationships cause disease?
That's an interesting question. Now, let's say you or me as a person, let's take my example. Let's say that me as a person, I am a very dominating human being. So I have a relationship with my family that I'm being very dominating. Now, when I'm being very dominating, obviously there's a pushback from the other side. Now, when there's a pushback, I don't like it, so I fight back. Yeah. So at any given point in time, I'm in this fight or flight mode where either I'm fighting all the time or I'm just leaving the scenario and going out for a smoke or a drink or just for a stroll to be able to calm down. Okay. What does that mean? That is emitting corticosteroids in my body at any given point in time, all the time. And it's the same with the other side. Now, they are feeling subdued, they are feeling I'm being dominated over. So, what happens to them? They feel another type of corticosteroid, not exactly the same ones which I am emitting, but their corticosteroids is something else. But corticosteroids are constantly being emitted in that environment, in that home, or in that office. And what happens is what are corticosteroids? Now, these basically get into your channels and start to block them and cause inflammations, as they call in allopathy, but actually it's choking of these channels in Ayurveda or epigenetics. And these chokings of the channels will not let the Vata or Pitta or Kapha pass through normally, or the information, that is the protein synthesis has to be done by the body, will not pass through. Okay, and what happens? These chokes eventually cause what is called as disease.